has any of the complications with this medication. And his serum B12 levels were low, estimated.
Hi, Miss Wheeler. My name is Haley, and I'm going to be taking care of you today. So we have a few medications that we have to give you, and I'll explain these here in a second. But first, I'm going to go ahead and grab my gloves real quick. I'm going to raise you up here. So first, I'm going to check and see your patient identifiers. So can you state your name and date of birth for me? Right patient. So I'm going to give you a few medications. First, do you have any allergies to any medications that you know of? Or any allergies in general that I need to be aware of? No? Okay, sweet. Okay, so the first medication that I'm going to give you is erythromycin. And that's just going to be given to you by mouth from a pill. And that's going to help prevent any infection that you could possibly have while you're here in the hospital. Then we're also going to give you a varicella vaccine, and that is going to be given in your abdomen. That's going to help prevent any infection from the varicella zoster virus, which is associated with chickenpox and shingles. And then I'm also going to give you dexamethasone, which is going to be given here in your shoulder or your deltoid, and that's going to help with, it's going to be an anti-inflammatory with the rheumatoid arthritis that you're having. So some common side effects of some of these are like nausea. Specifically with erythromycin, we have some common side effects of nausea, vomiting, or abdominal pain, or basically any kind of change that you feel like you're having after that. Please let me know. With the varicella vaccine, there could be some issues with the injection site. So there, again, notify me if you feel any kind of changes with that, as well as with the dexamethasone, since that's also an injection. So with that, if you feel any nausea, vomiting, or any kind of changes in your common well-being, let me know after that. Okay. Do you have any questions? No? Okay, awesome. So I'm going to go ahead and come over here and give my medications. So I have already identified that this is the correct patient, so now I'm going to go ahead and check the dosage, the time, the route, and the med to make sure that I'm getting all of the right things here. So first, with the erythromycin, we have 250 milligrams by mouth at 8 o'clock, and it is currently 8 o'clock, so we're at the right time. So I'm going to go ahead and grab my erythromycin. 250 milligrams by mouth, so I'll grab a medication cup as well as a cup for water. Set that here. I also need to get the varicella vaccine right here, and I'm giving her half of a milliliter. One dose is half a milliliter, so this is the correct vaccine. And then I'll be giving it subcutaneously at 8 o'clock. It is currently 8 o'clock, and I need a 3 milliliter syringe and a 25 gauge because I'm giving it subcutaneously, and so those are the requirements for that. And also too, because it's such a small dose, I'll use a smaller syringe because it has the increments are smaller, so it'll be easier to pull up. And then lastly, I need to get the dexamethasone. Here I'm administering 4 milligrams per 1 milliliter, so I'll be giving 1 milliliter, and that'll be given in the deltoid here at 8 o'clock, and it's currently 8 o'clock. And then I will also need a 3 milliliter syringe and a 25 gauge because I'm giving it in the deltoid, and it's a small amount of medication, which will be easier to calculate here. So again, I have my 3 milliliter 25 gauge for dexamethasone here, dexamethasone for Jamie Wheeler at 8 o'clock. I have my varicella with also my 25 gauge and my 3 milliliter here, 8 o'clock. for the same patient. And then my erythromycin, 250 milligrams, 8 o'clock for Jamie Wheeler again. So then I'm gonna move all this to back to my patient room and check again. Okay. All right, so again, I'm gonna check my patient identifiers. This is Jamie Wheeler. Birth date is 10/31/1947. This is all correct. I'm going to check the patient, the med, the dose, the route, and the time. Again, so I have my erythromycin, 250 milligrams by mouth at 8 o'clock for Jamie Wheeler. I have my varicella vaccine, half a milliliter by a subcutaneous injection at 8 o'clock. And then I also have my dexamethasone, 4 milligrams per 1 milliliter at 8 o'clock, Jamie Wheeler. And that's going to be injected in the deltoid because it's an IM injection. So first I'm going to start with the erythromycin.
Allergies confirmed. And it's a codeine allergy. I'm also going to go ahead and sit him up a little bit.
Okay. Also, before administering any of these medications, because my patient has dementia and rheumatoid arthritis, there were no other vital signs that need to be taken before this because none of the other medications have to deal with certain vital signs that are current. All right, Ms. Wheeler, so here is your erythromycin. I'm going to go ahead and give this to you here, and then also any water.
Medication.
All right, now I'm going to do the varicella vaccine.
By stimulating glucose uptake in the skeletal muscle and fat. And we're administering it because your glucose levels are
Okay.
high. So we're going to administer this daily.
So I'm going to first go ahead and wipe off the top of the cap since it's been used multiple times.
We're going to go ahead and administer.
And then I'm going to set up my needle. So I need to give half of a milliliter here.
Periodically during this therapy, I'm going to check your body weight. That's more of a long-term goal. I would monitor the blood glucose.
So I'm going to go ahead and pull up half of a milliliter
I wouldn't hold this
of air.
because my patient is not hypoglycemic.
I'm also going to go ahead and take this off.
I will evaluate the effectiveness of the medication after I give it. I'm going to talk to you about some
I'm not going to throw that away.
as well.
Okay.
So hypoglycemia is a common side effect as well as allergic reactions, including anaphylaxis.
And I'm pulling up half of a milliliter again.
If you don't have any other known allergies, we're not going to. That's not
I'm pushing the air
Do you
bubbles.
have any questions before I administer? Could you please tell me where you were last injected with your insulin? The patient verifies that you
And then I'm going to recap the needle since it has not been used. And now I'm going to switch out for the 25 gauge.
Again, I have the right patient in the date of birth is confirmed and his codeine allergy confirmed here for the MR. I'm going to be administering Vladimir, 100 units per milliliter, and we're going to use an insulin syringe and draw up 10 units that are prescribed. And I'm going to give this subcutaneously in the regular abdomen at 0800 in the morning.
Okay. Also, just extra precaution, I'm going to go ahead and have a second opinion check and make sure that I have all of my correct medications and everything. So you can just check and make sure that I have everything.
Yes.
Okay, thank you. Okay, so now I'm going to go ahead and do the subcutaneous injection in the abdomen. I'm going to move this here. So we're gonna wait for that to dry.
Air, invert, and drop 10 units of medication.
And then I'm gonna.
Tell me your name and date of birth. Alright, have Jamie Wheeler, date of birth, confirm. And do you have any known allergies again? Confirms codeine allergy.
So the subcutaneous injection is finished.
10 units of Poynter, which is insulin, subcutaneously.
Now I'm going to prepare my dexamethasone. I'm also gonna go ahead and pay for this.
And I'm going to be giving it through the subcutaneous route. So I'm going to go ahead and position my patient. First I need to here and allow that to air dry. Needle and then pinch and inject.
So I'm gonna pull up 1 milliliter.
Okay. I don't think we'll. So what do you want to do? My 40 minutes. You guys go. I know this thing just said it. No, we're getting so good at you.
So this is gonna be in the deltoid. So to find the deltoid, I first find the acromion process, and then depending on your finger width, I would go 3 fingers down and then find the triangle and then go in the middle of the triangle here. So that is where I'm going to wipe.
Yes.
Okay.
We switched up the wording for that, but I like got to the very end of mine and
We're gonna wait for this to dry. I'm also gonna go ahead and scoot my patient up here a little bit more. I'm gonna hold here just for precaution. And then I'm gonna go ahead and pull away and pull the needle out. And then safety cap it. And so I'm gonna raise this back up. So those are all the medications that I needed to give. So now I'm going to document. So I would document I would document the
Always.
medication, the time, the dosage, and the route, as well as any assessment findings that occurred, like after, like any side effects or immediate complications or anything like that.
Today, I'll be giving you 2 injections and some.
So I'm going to go ahead and document
Your name, date of birth.
here.
Have Jamie Wheeler, 103147. I see that he has an allergy ban, so I'm going to ask him what his allergy is, and he tells me that he has codeine.
So now I'm going to go ahead and return my medication.
Today I'm going to be giving you your influenza vaccine, which is going to help prevent
These things would normally not be returned, but I'm going to put it back for recycling purposes.
always, and I'm going to be giving you heparin. Before I give you any medication, I'm going to educate you on them. So if you have any questions, just ask. But I'm going to go ahead.
Thank you, Ms. Wheeler. I'm going to lower you back down here. You did fantastic. If anything, any kind of side effects start occurring that you're worried about, please let me know and I'll be coming back in to check on you. But you did great. And again, if you have any questions, please let me know.